Before anesthesia, surgery wasn't brave, it was torture. Patients were held down, alcohol was used as sedation, and amputations were sometimes completed in under 2 minutes because the patient was fully awake. The breakthrough that ended that suffering didn't come from a famous surgeon. It came from a dentist. So who invented anesthesia and who really deserves the credit? The answer involves rivalry, humiliation, ambition, and tragedy. Before the mid-1800s, surgery was something people feared more than disease itself. There was no reliable way to eliminate pain. Patients were restrained. Assistants physically held them down. Speed was considered a surgical virtue. The faster you cut, the less suffering the patient endured. Imagine agreeing to surgery knowing you would feel everything. That was reality. Now let's meet the first dentist. In 1844, a Connecticut dentist named Horace Wells attended a public demonstration of nitrous oxide, laughing gas. During the exhibition, a volunteer injured himself, but didn't seem to notice the pain. Wells had an idea. The next day, he inhaled nitrous oxide himself. Then he had a tooth extracted. He reported feeling little to no pain. That moment was revolutionary. For the first time in history, dentistry didn't have to mean agony. Wells began using nitrous oxide in his practice. And it worked. But he wanted the medical world to take it seriously. So he arranged a public demonstration in Boston. And this is where everything went wrong. The patient cried out. The audience laughed. They declared it a failure. Even though the patient later admitted the pain was minimal, the damage was done. Wells was humiliated, and he withdrew from the spotlight. But the story doesn't end there. Another dentist, William T.G. Morton, had previously worked with Wells. He believed nitrous oxide wasn't deep enough, so he experimented with ether. On October 16, 1846, Morton publicly demonstrated ether anesthesia at Massachusetts General Hospital. A tumor was removed. The patient remained still, no screaming, no violent reaction. When the procedure ended, the surgeon reportedly said, "Gentlemen, this is no humbug." That day became known as Ether Day, and from that moment, surgery changed forever. So is Morton the man who invented anesthesia? Not exactly, because there's another twist. A physician named Crawford W. Long had actually used ether successfully in surgery in 1842, 4 years earlier, but he hadn't widely published his results, so history didn't immediately recognize him, which means the answer to who invented anesthesia depends on what you mean. First to use it? First to prove it publicly? First to publish it? History isn't always clean. But this story takes an even darker turn. After his failed demonstration, Horace Wells struggled deeply, both professionally and emotionally. He began experimenting heavily with chloroform, another emerging anesthetic at the time. In the 1840s, there were no safety standards, no regulations, no real understanding of dosage. Self-experimentation was common. In 1848, while in New York and reportedly under the influence of chloroform, Wells threw sulfuric acid on 2 women in the street. He was arrested and jailed. After being released on bail a few days later, he returned to his lodgings. There, he inhaled chloroform again to sedate himself, and ended his life. He was only 33 years old. Morton spent years fighting for recognition and financial reward. He never received the fortune he believed he deserved. Both men changed medicine forever. Neither lived to fully enjoy the recognition. Without anesthesia, there is no modern surgery, no hip replacements, no cancer operations, no C-sections, no organ transplants. Modern medicine depends on the ability to safely eliminate pain. And here's what most people don't realize. The breakthrough that ended surgical torture began in a dental chair. Dentists were confronting pain every day. That urgency forced innovation. Today, we walk into dental offices and surgical centers assuming comfort. We expect not to feel pain. That expectation didn't exist 180 years ago. So, who invented anesthesia? It wasn't one person. It was a rivalry, a failed demonstration, a bold public breakthrough, and a refusal to accept unnecessary suffering. If you found this fascinating, I share more surprising medical and dental history right here. Because sometimes the most important breakthroughs start in the most unexpected places.